deleterious metabolic effects of high-carb, sucrose-containing diets in patients with non-insulin-dependent diabetes. Fasting and postprandial triglyceride levels were increased, and high-density lipoprotein cholesterol concentrations were reduced when the patients ate the low-fat, high-carb diet. Finally, since low-density lipoprotein concentrations did not change with the diet, the HDL-LDL cholesterol ratio fell in response to the low-fat, high-carb diet. It was actually making them sicker, is what this is saying. You're shaking your head going, wow. Effect of a high or low-fat diet on cardiovascular risk factors in male and female runners. 16% fat diet versus 42% fat diet. Results: runners who increase fat intake to 42% further raise their HDL cholesterol without adversely affecting other lipoproteins. Low-carb versus low-fat diets on weight loss and cardiovascular risk factors. A meta-analysis of randomized controlled trials. Basically, they looked at all the data that was in the database, in the history of the database. They went back as far as they could, and they looked at all the randomly controlled trials. And they want to see, they compared low-carb diets versus low-fat diets on cardiovascular risk factors and weight loss. What were the results here? Well, let's see. Individuals assigned to low-carb diets lost more weight than individuals assigned to low-fat diets. Okay. Triglyceride and HDL cholesterol values changed more favorably in individuals assigned to low-carb diets. And low-carb, non-energy restricted diets appeared to be at least as effective as low-fat, energy restricted diets in inducing weight loss for up to 1 year. I want to just focus in on this last one, because the first one we've beaten into the grounds already. I hope you believe these things. It comes over again. But look at this. This says here, non-energy restricted diet. In other words, you can eat as many calories as you want on a low-carb diet and lose more weight than a low-fat diet that actually counts calories. This is a meta-analysis of all the control trials looking at low-fat versus low-carb. Now, recently this came out, it was about a year ago, in the New England Journal of Medicine. You may have heard of this study. They compared the low-carb diet versus the Mediterranean diet to a low-fat diet. Did anybody remember this? It was on the news for about 5 minutes because it actually was not very popular. What did it show? Well, amongst the three diets, the low-fat, restricted calorie diet. Oh, here's the three diets. Low-fat, restricted calorie. Count those calories. Starve yourself. Go hungry. Versus the Mediterranean restricted calorie diet. Okay. Count your calories. Go hungry. Or low-carb, non-restricted calorie diet. Eat as much as you want. Don't worry about the calories. Just keep your carbs down. What were the results? The mean weight loss was 2.9 kilograms for low-fat group, 4.4 kilograms for the Mediterranean diet group, and 4.7 kilograms for the low-carb group. Guess which group lost more weight? Well, it's right here in black and white. New England Journal of Medicine, 2008. Lastly, the relative reduction in the ratio of total cholesterol to high-density lipoprotein cholesterol was 20% in the low-carb group and 12% in the low-fat group. These people changed their lipids more favorably in the low-carb diet than the low-fat diet. Is this a win, 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 win? Gee, I can eat pretty much what I want, not go hungry, lose weight, increase my hormone levels, and reduce my risk for heart disease? What's wrong with this picture? How is that possible? You know, they say if it sounds too good to be true, it probably is. Well, I didn't write these things. Fluctuating blood sugars can really wreak havoc on your system. Controlled blood sugar is one of the most important homeostatic controls. Homeostatic meaning it's almost like a thermostat, controls in your body. If your blood sugar is too low, you get what's called hypoglycemia, low blood sugar. And since your brain depends on glucose to function, God knows what this will do to your thinking processes. If you suffer during the day of things, man, I can't think straight, my brain is foggy, whatever, it may be because your blood sugar is too low. It could cause depression. It can also cause anxiety because it actually activates what's called the sympathetic nervous system. When your blood sugar drops, adrenaline will come out of your body to try to raise it. And adrenaline can cause a lot of symptoms. It could raise your blood pressure. It can make you nervous, cause sweating, palpitations, stomach problems. I'm going to get into all these things in a minute. If your blood sugar is too high, well, that's called diabetes. And elevated glucose levels cause severe cellular damage. It just really mucks up. If you ever get sugar on your fingers, it's a very sticky molecule. Well, it sticks to everything in your cells as well. And these things are called advanced glycosylated end products, AGEs. You guys have heard of hemoglobin A1C? If there's any diabetics in here, you know diabetics, we always measure hemoglobin A1C. Well, what is hemoglobin A1C? It's sugar stuck to your hemoglobin. It's an advanced glycosylated end product. So if the blood sugar is too high, you get those. It also causes free radical damage. And when your blood sugar goes too high, it'll actually activate your parasympathetic nervous system. Your insulin levels go up and try to drop your sugar. So you don't want to have fluctuating blood sugars, okay? Let's talk about this thing called the autonomic system for a minute, okay? We have a control mechanism in our body which controls a lot of our functions. Right now, this is a voluntary movement. Okay? Can I control my heartbeat? Can I make it go faster right now? Can I make my pupils get bigger or smaller? Can I activate my immune system? Can I activate my bowels or my bladder to start or stop? Well, no. But the autonomic system does. And we're dependent on it. It's our thermostat. And one of the things that the autonomic system does is it controls blood sugar, and blood sugar controls that system. I just mentioned before, when your blood sugar drops, you actually activate the sympathetic branch, and when your blood sugar rises, you'll activate the parasympathetic branch. So you may be actually experiencing symptoms from fluctuating blood sugars. Why do I bring this up? If you eat a high-carb, low-fat diet, as recommended by the experts, okay, if you start your day with fruit and whole grain, organic, whatever it is, your blood sugars are going to go up. Guaranteed. And then there's a good chance they're going to come crashing down. And so if you experience a lot of symptoms after eating, it may be because you're actually activating your autonomic nervous system. And if you're hungry, a lot of people, they eat every 2 hours because their blood sugar is just going up and down and up and down. Every time your blood sugar crashes, you will be hungry. Whether your stomach is full or not, you will be hungry. Okay, and so if you find yourself just eating constantly all day, and especially eating a lot of carbs, you're on a vicious cycle. So the autonomic nervous system, there's two branches. One is called the sympathetic, one is the parasympathetic. This is like the gas pedal. And I'm going to give you an example. If all of a sudden a grizzly bear came running through that door, guess what would happen to your pulse rate? Go up, right? Pulse would go up, your blood pressure would go up, your pupils would get big, okay? Your digestion would stop. There's a whole lot of things that happen. Dilated pupils, your saliva would actually stop flowing, your heart rate would increase, your lungs would dilate, your digestion would stop, you would actually raise your blood sugar, you'd inhibit the release of bile, so you'd stop digesting everything. You basically, you downregulate your immune system, your bowels would stop working, motility slows down, your bladder would contract, the sphincter at least, so you don't pee on yourself. Okay, this is what's called the fight or flight response. So you're scared, you are going to try to survive that 1 minute of terror, and we've been programmed through evolution to actually survive that by activating our sympathetic nervous system. Well, if your blood sugar is low all the time, you could be suffering from excessive activation of the sympathetic nervous system. How many symptoms could come out of here? Well, let's see. Dry mouth, dry eyes, tachycardia, palpitations, heartburn, diabetes, liver problems, constipation, lots of infections, difficulty peeing. There's a zillion more. This is just a short list. So how many symptoms can people get because their blood sugar's too low? How many symptoms can people get because their blood sugar is too high? Let's go on this side. Small pupils, stimulates flow of saliva, low heart rate, constricts bronchi. This is asthma here. Increased digestive secretions. Well, that could be heartburn too. Conversion of glucose to glycogen. Weight gain, low blood sugar, stimulates release of bile, excessive bile production, upregulates immune system. This is allergies, motility speeds up, irritable bowel syndrome, sphincter relaxes, irritable bladder syndrome. So you can get all sorts of symptoms from eating a low-fat, high-carb diet, which has nothing to do with metabolic syndrome.